really important to not only all of the country, but half of the country, the women of America. I'm Amelia Sykes, Congresswoman representing Ohio's 13th Congressional District, and I am also honored to serve as the Vice Chair of the Democratic Women's Caucus. I want to thank my colleagues from the Democratic Women's Caucus for being here today, and really excited that we get the opportunity to call out the Republican hypocrisy based on their health care crisis. So here's the reality. The enhanced ACA premium tax credits that make health care affordable for millions of Americans are set to expire at the end of this month. And as one of my constituents so eloquently explained to me, open enrollment ended on December 15th, and they were forced to make decisions 2 days ago about their health care with no response or answer from Congress. Because Congress has failed to act, and if we do not act before the end of the year, families will see their premiums spike by double, triple, maybe quadruple, costing them an additional hundreds of dollars a month for cash-strapped families that are already struggling to afford day-to-day expenses. In my district alone, 90% of the people who get ACA coverage rely on these tax credits. That's 22 million people across this country who could face hundreds of dollars or more each month, or thousands of dollars each year. 4 out of 5 people were able to find plans for $10 or less per month. And letting these credits expire will reverse the progress and push more than 4 million people off of coverage. We have all been fighting for this coverage. Co-sponsoring Rep. Underwood's Health Care Affordability Act, urging leadership to act in introducing legislation to stop harmful ACA rule that could force 2 million people off coverage and bury families in paperwork. Even some Republicans agree that action is urgent. Our colleague, Republican Mike Lawler, called the Speaker's refusal to allow a vote on extending these subsidies idiotic and political malpractice as premiums are poised to rise. Rep. Lawler, I agree. Idiotic and political malpractice are both adequately representing what the Speaker is doing. But I would also add that it is cruel and mean-spirited. So in response, because we believe in solutions and problem solving, Democrats propose a clean 3-year extension of the affordable tax credits. 214 Democrats have signed on. And as of a couple of seconds ago, when the Speaker gave me this note, we have now made it to 218 signatures.
That's amazing. Courage.
Thank you, Madam Speaker, for the assist. But to bring this back to reality, we are already seeing the consequences of the Republicans' political malpractice and idiotic behaviors. In my district, AltCare has announced that it will stop offering some individual, family, and small business plans next year, affecting 6,000 people because of uncertainty over these credits. The House Republican healthcare bill that they are proposing is deceptive at best, cruel at worst, but it will cause an additional 100,000 people to lose healthcare coverage, and that's why I introduced an amendment to remove the section responsible for the increase and to strike language aimed at restricting abortion coverage. Again, Congress must act now. And now we have 218 people who believe in what we believe. Families deserve access to affordable health care without political games or interference in personal medical decisions. And I know that the Democratic Women's Caucus and the Democratic Caucus will continue to fight to make sure health care is affordable for every American. You will hear from several of my colleagues, and we will take questions at the end, but I will now turn the program over to Congresswoman Maxine Dexter from Oregon's 3rd District.
Thank you.
Good morning. I am so excited that Republicans are coming to their senses. It's a joyful morning. I am Congresswoman Maxine Dexter. I am a mother, a physician, and the very proud representative for Oregon's 3rd Congressional District. And I did not spend 20 years saving lives in an intensive care unit to come to Congress and turn my back on the American people when they need us most. So I'm here to say this clearly. Republicans are denying the opportunity to vote on a clean extension of the ACA tax credits, and now 4 of them have come to their senses, and we need a vote before we go home. Instead, they are pushing a backdoor abortion ban that would strip millions of women of coverage. And here's how it works. Under the proposal that they have put forward, Republicans are cutting reimbursement for any ACA plan that offers abortion coverage. That will leave insurers with a choice: drop abortion coverage or raise premiums. Neither are acceptable, and either way, women lose. And we know exactly what happens when abortion access disappears. In states with abortion bans, there have already been hundreds of excess infant deaths, dozens of pregnancy-related deaths, and a 50% increase in sepsis among women who lost pregnancies. I have taken care of those women as they exsanguinate and die in the ICU. It is absolutely a tragedy, and it's preventable. More women will unnecessarily die if this bill passes. They are doubling down on the cruelty. They are cost sharing as a policy lever to override medical judgment, and it is absolutely not reform. It is a misuse of federal authority to impose ideology. My community needs relief. If this bill fails to deliver that, while instead inching us closer to a nationwide abortion ban, it is something all of us need to stand up and say no to. And that is why I will oppose this proposal. I will fight for policies that lower costs, protect coverage, and respect patients, doctors, and the law. So now that we have 218 signatures on our discharge petition that will extend the ACA tax credits for 3 years, the enhanced premium tax credits for 3 more years, we need a vote. And I hope that our Republican colleagues will come to their senses and end this cruel attack on America's health coverage. I cannot be more honored. I honestly cannot believe that I get to say I now yield to Speaker Emerita Pelosi.
Thank you very much, Congresswoman Dr. Maxine Dexter, for your eloquent statement that you did not come here after a professional lifetime of service to saving lives to participate in what the Republicans have on their mind. Cruelty. It doesn't even make sense. I thank the press who was here because this is where it's happening. These women have been supporting what our distinguished leader, Hakeem Jeffries, put on the table, this 3-year extension. But it took a lot of, shall we say, mobilization on the floor of the House, and I thank so much the distinguished chair of the Women's Caucus, Teresa Fernández, and Vice Chair Amelia Sykes for bringing us together to point out that each and every one of them on the floor of the Republicans are putting forth legislation that doesn't even make sense, much less have any sense of values to it. It's very harmful. They're going at it again. They did this before, and now they're doing it again. This time they're calling it reform and reduce. Reform and reduce what? The care that people can give to their children. So our colleagues have very eloquently pointed out what is at risk, what is at stake here. But to enlarge the issue for a moment, just to know that families that have had to declare bankruptcy have largely done that because of healthcare cost. This makes matters worse for them if they do not extend these. Now, again, as someone had something to do with the Affordable Care Act, but more importantly, as the mother of 5 children in 6 years and 7 days, we know what we're talking about when we talk about maternal health here. Perhaps our colleagues on the floor have either ignored that or don't care about that. And now we have the 218 votes. And now it's up to the Speaker to follow the rules of the House and not abandon us on the time frame. We want it now. We want it, and we want it now. We want it now. Again, this is as women will lose access to essential services. Working families will lose financial security. And again, parents will be one diagnosis away from possible bankruptcy. But more important than that, the confidence they have that they can provide for their children, for their families. This comes right down to the kitchen table of America's working families. We hear you there. You want to talk about affordability. affordability of health care is really one of the main issues that is so upsetting to America's families. We have an answer. We have the votes. Bring it to the floor. And thank you to the Women's Caucus for their leadership on this, and with respect to our distinguished leader, Mr. Hakeem Jeffries, for bringing that important discharge petition. Now, just for the public knows, when there's a discharge petition and you get 218 votes, which is the majority of the House Democrats, then the bill comes to the floor. We want no obstacles. We want action. Now it's my pleasure to yield to a fighter for women's maternal health and health care in general for all, come from a state that has been in the lead in health care. We learned a lot from Hawaii, and we're very honored to serve with Joyce Tokuda, whom I'm happy to yield to.
All right, I'm here. Thank you, Madam Speaker. Aloha, everyone. And Amelia, I got to tell you, not many people, oh, she's right there. Amelia just literally took my script and ripped it up because it was 2 pages of how we've got to get shit done today for the American people. And it looks like we have. I want to remind you that women, mothers, caregivers, upholders of our community, we're here in what could be considered the 11th hour of this Congress. And we are still fighting like hell to make sure they get their hands off our health care and they reprioritize what is right. And that is extending the Affordable Care Act, premium enhanced tax credits, making sure that we can continue to make health care affordable for millions of Americans across this country, including in my very rural and remote home state of Hawaii. You know, my colleague was just clinching me as we got the news of 219. Rashida was like, women changed the world. We changed the world. And she's absolutely right. We do. Because no one's going to fight like a mother. That's right. 6 years, 7 days, 5 children. No one's going to fight like a mother to make sure that every child has what they absolutely need, which is access to quality, affordable health care when they need it, wherever they need it, regardless of what zip code they live in, regardless how much money their families have. We fight like mothers for all the children of this country, and that's why we are here. Because in 15 days, if we do nothing, affordable health care will vanish. The Grinch will steal life-saving, life-enhancing, life-giving care for millions of Americans across this country. And I've talked to people in Hawaii, like a mother in Wailuku who was laid off this year, and she and her husband now drive Uber 7 days a week just to stay afloat. And if you've ever gone to Hawaii, you know the cost of food is easily double or more the prices of anywhere in this country. Housing, people cannot afford even the roof over their head or the electricity to keep lights on. And now she's told me she's being forced to choose between health care, her mortgage, and being able to keep her son in preschool. And that's her new reality heading into the new year if we do nothing. And I've heard from a 61-year-old woman who left her job to care for her sick husband. Her premium is about to rise up to $1,300 a month. $1,300 just for herself. And she told me she simply can't afford it. And she's preparing to go without coverage and pray nothing happens to her, that she doesn't get sick. Now, can you imagine this multiplied by millions? And the fact that people are looking at a premium they simply cannot afford and praying that an illness, an accident, some kind of tragedy does not plummet them into medical debt and bankruptcy. But we have a choice. We have a choice today. We have a solution right in front of us. And thanks to brave people, I'm not even going to say the R word, people, human beings who understood that this was not a partisan choice, this was not a partisan decision, this was a people decision. We have the chance in the next 3 days to take one simple vote that will put Americans first and restore affordable health care for millions of Americans throughout this country. The greatest gift that we can give American people this holiday is certainty and affordability. The certainty that when someone they love, when they get sick, they can afford to get the care that they need. So I'm asking all of my colleagues, regardless of what party you affiliate, do the right thing, force the vote. Let's get this done today. Mahalo, and it is my privilege and my honor to introduce our Democratic Women's Caucus leader, Chair Teresa Fernández.
Mahalo, aloha, buenos dias, kawatsi, yatahe, danjo, everything, because we are happy today, because indeed we have seen courage, and some hearts are no longer two sizes too small, right? We've got a couple of people whose hearts are two sizes too small. And I think that what's really important right now is to call out the differences, where Democrats, joined now by 4 Republicans and hopefully more, who will vote against the rule and vote against the Republican bill, whose goal was to bring down the cost of health insurance premiums, whose goal was, when we passed the Affordable Care Act, to increase the number of Americans insured, whose goal was to make sure that pre-existing conditions, that being a woman was not a pre-existing condition, whose goal was to extend health care to as many Americans as possible, compared to what the Republicans are doing with their proposal, which would hurt women and steal health care in many different ways. Dr. Dexter explained how their bill is a backdoor attempt to restrict abortion. And let me give you another comparison of 2 states. In Texas, Amanda was having a miscarriage. She could not get care because of the abortion restrictions. She had to go into sepsis and almost die. In New Mexico, I also almost died when I was pregnant. But because I lived in New Mexico, I could be on the operating table bleeding to death. And I could make decisions about my own health care in consultation with my own doctors, knowing that it would be covered by my health insurance because I lived in New Mexico. What Republicans would do is force their abortion restrictions that they have in Texas to places like New Mexico, because they would restrict our ability to get health insurance. And that is the difference between what Republicans are proposing and what Democrats are proposing. And it's not just with regards to health care. Their junk plans that they propose in their bill are not required to cover maternal or prenatal care, or to take care of the infants. You cannot tell me that you value life if you do not value protecting the life of women and newborns. And it goes on. Their proposed junk plans would allow you to basically discriminate on the basis of gender. So a business that has more women employed would have to pay more, or worse, go without health insurance. Indeed, their bill increases the number of Americans who will lose health insurance by 100,000. So their proposal takes it to 4.1 million Americans who will lose health insurance because of their plan. And this is the difference between how Democrats see health insurance as a need that should be affordable and accessible to everybody. And as our wonderful Speaker Emerita has pointed out multiple times, it is about being one health emergency crisis away from bankruptcy. And it is women and families who will bear the brunt. So I celebrate with my hermanas and sisters here that we now have the discharge petition. But we need to say, Speaker Johnson, don't be a Grinch. Call that vote right away. Call that vote before we leave to Christmas. Let's give that Christmas gift to the 20 million Americans who rely on those tax credits. And with that, I will open it up for questions.
Actually, I'll pick up a question for Speaker Emerita Pelosi, if I I may. You mentioned your role, how instrumental you were in making sure that the ACA was not only enacted, but these premium tax credits were passed in 2021 and 2022. I'm curious, what would you say, given kind of your unique position in all of this, what would you say Republicans fundamentally misunderstand about health care the way that you see it, whether it's these premium tax credits or the broader legislation? What don't you think Republicans understand? How would you convey to the American people the disconnect that you see between your vision for health care and theirs?
Well, I think the difference between the Democrats and the Republicans is we are here for America's working families. They are not. And their decisions are very political in this regard. Why on earth? It's hard to understand. Why on earth would you take away from families something so central to their financial security, but also, first and foremost, their health security? So there's no understanding of it except it's very, very political. And of course, they have abolished the House of Representatives or the Congress of the United States to just do whatever the president says. So this is about them. It's about the president. It's about MAGA. It's not about doing anything that is wholesome and right and respectful. And as has been pointed out by our distinguished chair of the caucus and other members here too, there's so many provisions, and that, quite frankly, they don't tell the truth about it. Pre-existing conditions. They say, oh, we take care of that. No, you don't. You do if you have, or you're very wealthy. But they just don't understand this one important thing, that unless the poorest person in America has access to health care, everyone in our country is susceptible to the contagion that might cause. The wealthiest person who has his own nurses and doctors and this and that, they're not protected unless the least among us are protected. So this is about health care for all, the poorest and the wealthiest, because we are all breathing the same air. And I can't even possibly share with you what the motivation is with the Republicans, because it is not values-based, it is political, and it is most unfortunate. And we're going to have a majority in the next election, so we can proceed. But hopefully we won't have to correct their mistake. Hopefully the 218 will be even a bigger number, and the Speaker will honor the rules of the House and not the dictate of the White House and bring up that bill. Okay? Thank you. Anyone else have something to say on that? Do you understand the Republican motivation on this? It's horrible.
Well, they're always standing. I think that there is a big comparison of what Republicans are always doing, right? Yes, last night in the Rules Committee, they kept saying, oh, but it only affects 7% of the American public. That's 20 million people. But when we ask them, why should we extend and make permanent the tax cuts for 700 billionaires, they said, oh, because it's really important. Like, so they were willing to go to bat for 700, maybe 800 now, billionaires. But they were not willing to go to bat for 20 million Americans. That, I think, is the biggest difference, is they continuously stand with the biggest corporations and the wealthiest Americans instead of those small businesses, working families who need the help.
And one more point as to that Madam Chair said. They did this in the same bill. They gave a tax cut to the wealthiest people in our country at the same time as they were cutting off millions of people from Medicaid, took $500 billion out of Medicare. $500 billion out of Medicare, and again, millions of people off of Medicaid. And these are people, it's not just poor children, although that would be justification enough to have Medicaid. But it's a middle-income benefit, too, because long-term health care for middle-income families is paid for largely by Medicaid. So how do you, who in the room? One time I said to them, I said to them in the course of another debate, I'm following Pope Francis on this. And the Republicans said, you're following Pope Francis, I'm following the stock market. I rest my case.
And votes have been called, and we're going to go up and vote against this rule and against the cuts to health care and women's health. Thank you very much for
Against the
participating.
rule too. When you say the 4 people have to be voting against the rule.
I think we'll see what happens. We'll see if people vote, because I think that's the intent of the only thing you have to do is you have to kill this bill.
Yeah.
So we'll see.